On April the 25th, there was a devastating earthquake, a 7.8 earthquake in Nepal.
The devastation was beyond what I had anticipated.
It was shocking from a perspective of what little these people had. And it was shocking to see what little they had gone.
International Medical Corps was notified that potentially the Trauma Surgical Deployment Unit, which is for us the mobile field hospital, which we are attached to as a team in combination with Massachusetts General Hospital and Stanford. Their disaster humanitarian response teams and then our team, the three of us respond as an asset combination with that TSDU, which is the Trauma Surgical Unit. In a matter of days after the assessment was completed, it was identified that the response that was needed was a rapid mobile response team, and they requested a team of nurses and one logistics person to respond with the Massachusetts General team.
Why do we do it? Well, number one, it's the right thing to do. And I think Mother Mary Michael Cummings and Miss Ellen Browning Scripps would be proud of the fact that the missions they established here in San Diego literally can reach around the world at a minute's notice now. But we get a lot back in return, that expertise that you just cannot buy and train for. So we're going to be better prepared if and when a disaster hits us here at home.
We're carrying the mission of Scripps, and that's what's important about what we do.
To be gone for 3 weeks and to, the feeling of, wow, I'm leaving San Diego, I'm going into the unknown. And a couple of us, of our team, had been to Nepal and that part of the world before, but most of us hadn't. And so we really didn't know what we were getting into.
You take care of yourself, right? There.
Yeah. Okay.
There, my number one request was that they take care of each other. That it was very, very important for them to watch each other's backs and make sure that they had a good time but were safe, and that it was the responsibility of the entire team to make sure that everybody came home safe. This took them over 30 hours, flying from San Diego to San Francisco to Frankfurt, Germany, to Istanbul, into Kathmandu.
So looking out of the window of the plane as we approached the airfield and looking out at Kathmandu and looking out at the countryside, I could see that there was significant devastation, but I could also see the population moving around, which gave me great relief.
And there were 2 missions. One would be to reach the outlying areas, which are very rural, hadn't been touched, and that would be in the Gorkha district. And the other one would be a deployment to Dading.
Our teams actually never saw each other from the time they arrived and were split up till the time they got back together to come home again. And so we really had almost 2 different missions going on a daily basis in Nepal, but we were able to keep track of everybody here at home.
Steve and I were assigned to the Massachusetts General team, and our team as a whole actually totaled approximately 12 to 16 people.
So we were in the Dading district. We had 6 different missions, so 6 different villages that we did clinics in. One of the villages was accessible by road, and when I say road, I use that term very loosely. It was off-roading, basically, and the other ones were accessible by helicopter only.
My specialty was wound care. There was crush injury from falling debris or being trapped in the rubble. So we became very creative. We knew we didn't have any x-ray, so we had to assume there possibly was a fracture. Those that we felt were significant injuries were flown out. We would take them back by helicopter to the hospital in Kathmandu or in Dading.
For me, I acted as a pharmacist during this time frame, so trying to explain the medicines to the patient, when they needed to take it and what to be looking out for when they were taking the medication. And so they would say, this is like Benadryl. This is a Benadryl, and what the dosage was. So I would take it and I would write it on one box. And then I just had a running list. So I'd go through all the different meds and what it could be used for and what it was similar to in the United States.
We deployed into 7 different areas. We were based in Gorkha, It started with the core team between Massachusetts General Hospital and us. They had 2 nurses and a physician on their team directly. And then it was the 3 of us. It was Jan, Deb, and myself. Every day we hopped on a helicopter. The helicopter took us to various locations. The farthest north was about 16 miles away from the Chinese border. We went into very extreme situations where they lacked food, shelter, water in some situations.
Well, I had the advantage of getting to see every patient in every village, and there was a broad spectrum of diseases, from really acute injuries that maybe were broken bones or injuries directly related to the earthquake, to the full spectrum of chronic illnesses that folks had for 20 years.
We did also see a lot of psychological trauma from the earthquake, and that manifested itself in a lot of different complaints that were absolutely real physical complaints, but were brought on by the stress and the environment that the earthquake had caused in the villages.
The entire village participates in the intake process, whether it's determining how old the patient is. I recall one woman who was very firm on her age, and as the discussion ensued around her sisters saying how old she was, her neighbors saying how old she was, her husband giving a different number, she held very firm in how old she was, and she was not going to allow any general discussion.
Well, when you called people's names in the village, they primarily all had the same last name, which was their, part of their district naming. So Garoon was one of our very common last names in all of the villages. And there's a naming convention that we learned, again, through our physician, that the last girl born in any family receives the name of Conchi. So we would call for Conchi Garoon, and we might have a 5-year-old, a 43-year-old, and an 87-year-old step forward to be treated as Conchi Garoon. So we quickly learned that we needed to, call by the name and the age, and sometimes the problem that they had registered with, because there absolutely was no such thing as HIPAA in Nepal.
We had realized pretty early on that there were a lot of areas around Korla that hadn't been served, and word got out, and we all of a sudden started to get this barrage or bolus of patients that started to come through, and we said, whoa, we're supposed to leave in 6 hours. There's no way we can leave. We found out that people were walking from 10 or 12 miles away in this rugged terrain to get to us.
We had a patient in one of our clinics that had a double heart valve replacement a couple of years before, and this was a young man, 36 years old, and he was, the major breadwinner for his family. Normally he would walk for about a day to get his medications refilled, but he didn't know even if that was possible because of all the landslides and the fact that the trails may have been washed out. And he was really having to make a decision: do I stay and help my family ensure their safety by rebuilding their house, or do I go and see if I can get my medications refilled? And these are medications that are life-saving. Without them, he had a real possibility of dying. So we were able to coordinate with IMC and with our helicopter pilots to get him airdropped the next day the medications that he needed.
The day of the 7.3 earthquake, we were preparing to leave the village and finally packing up a few of our things.
We realized it was more than an aftershock when it kept going. So we all went out into the street. And as we walked out into the street, I would say hundreds of people were running down the street screaming, children were crying. And so we followed because we thought they knew where they were going. We needed to get out of the shadows of the buildings, and ran to an open field.
And that occurred, of course, in the morning in Nepal, but it was basically the middle of the night here. And the way we had our systems set up is I was alerted about the earthquake from outside Scripps sources immediately, and literally within 5 to 15 minutes, I had been verified, or I was able to verify that our team members, both teams, were safe.
People there are going to be living with this level of anxiety and fear and real threat for a long, long time. We get to leave. We got to, move to a different village. We got to come home, but they're going to be faced with rebuilding their communities, rebuilding their houses, trying to rebuild their lives in the face of the monsoons and just several years of uncertainty now.
This is the first time I actually have become emotional about this, but I really formed great relationships with these people, and they're young, and they still need a lot of mentoring and support, and because their entire population is struggling, that support is not there, and so I feel a loss leaving them behind.
If you think about it in the context of things, 8,000 people died. We treated over 2,000 people. I feel like we really had a huge impact there.
You know, we learn about the challenges with communication and the challenges with transportation and all of those things that would hit us here at home if we had a major disaster here. And so we think that the lessons learned are really, really important that our team can bring back and then teach others in our own organization and in the community and frankly nationally. You know, there's the team of 5 that deserve all the credit in the world for what they did, but there's also a support team here at home that deserves a lot of credit for being available 24/7 in contact with the team daily, at least a couple of times a day, without a whole lot of recognition, but they play a very important role as well.
I feel that the entire Scripps community, all of the employees, all the physicians, and really everybody that supports us all as Scripps employees really made the difference. We were just privileged to be there to represent, and I know that I certainly feel very proud of having had the opportunity to do that.
God bless you all. You did great work.
Thank you, Chris.
It's felt really like an entire family was there with us, and an entire family has brought us home.